Our PBL project is on guided meditation by Lauren, Chelsea, Jasmine, Michael, and Jackie.
For our needs assessment, we interviewed patients, staff, and clinical adjuncts at Kahimahala and discovered that many patients suffer from PTSD and anxiety. We decided that it is important for them to learn different techniques to reduce anxiety that is accessible to them regardless of where they are at. We came to the conclusion that a form of guided meditation would meet the goal and can be done anywhere.
For our guided meditation, we incorporated sunlight therapy, music therapy, and pranayama. We found that direct sunlight increases serotonin, which reduces stress and creates a sense of happiness. The song Weightless by Marconi Union, which was developed by therapists at the British Academy of Sound Therapy, proves to reduce stress and anxiety. And pranayama, which is an Indian breathing technique commonly used in yoga, helps facilitate a feeling of relaxation.
In this article, an Indian breathing technique that utilizes different styles and durations of breath holds showed numerous health benefits for improvement of cognitive function and mindfulness, whilst also promoting healthy coping practices to reduce stress and anxiety. This article study had 74 patients with diagnoses of PTSD between the ages of 30 to 54, where they were divided into two groups, and the results showed that it supported the initial research hypothesis that this Indian breathing technique was an effective treatment for the diagnosis of PTSD.
The purpose of this article is to understand the attitudes and experiences towards yoga of teens who are stressed and depressed. The population focused on 22 teens between the ages of 14 through 18, and they were split into 3 focus groups of 14 and 8 being individually interviewed. The first group was asked questions about their perceptions of yoga. The second group watched a video of yoga demonstrations, followed by their thoughts of the video. And the third group was asked questions about class logistics. A major concern amongst the teens was self-consciousness, but overall, many of the teens found that yoga is beneficial, stating that it's calming and relaxing and provides relief of stress. After watching the video, they liked that the teacher was non-judgmental and they felt better after viewing it. They also didn't mind being in class with others because they didn't feel judged or isolated due to being able to relate with others with the same experiences. The patients of the adolescent population at Kahimahala are diagnosed with depression, so incorporating yoga may be beneficial for them as it can promote relaxation and decrease stress levels.
The purpose of this article is to determine the effectiveness of yoga and mindfulness interventions on symptoms of anxiety. The population consisted of 88 middle school students in New Orleans, ages 11 to 14. Standard intervention sessions included focused breathing for 5 minutes, warm-ups for 10, yoga postures for 20 minutes, games and instructional content for 5, and final relaxation for 5 minutes. Anxiety and depression decrease in the intervention group. Anxiety decrease and depression symptoms increase in the control group. The racially diverse urban setting reduced bias in the study. Adolescent population at Kahimahala are likely to experience stressors including feelings of isolation and academic pressure, in addition to their anxiety and depression. Yoga and mindfulness interventions may help with emotional control and coping with stress.
The purpose of this study was to identify benefits of combining trauma-focused cognitive behavioral therapy with stress-reducing breathing techniques. The study used pranayama, which is the same technique we used with our population, and the applicability to our population is that a lot of the kids that we worked with suffered from PTSD and had difficulty dealing with stressful situations or anxiety out in public. So we wanted to find a way that would help them kind of ease those stressors. And so in the study, they found that they using the breathing techniques in combination with the therapy actually reduced the severity of PTSD symptoms and improved mental quality of life. One of the only weaknesses they found of this study was it was just subjective reporting, so the placebo effect is possible. And also that it would have been more accurate if they could do brain scans to actually visualize the differences.
For our fifth article, Kent et al. 2009, the study was to prove there is a direct link between the amount of sunlight exposure and cognitive impairment in individuals with depression. Researchers were able to gather large amounts of participants through a 6-item screener. They were able to assess their orientation and cognitive abilities, and through NASA's technology, they were able to calculate the amount of sunlight exposure. This study clearly proved our theory that direct sunlight increases the neurotransmitter serotonin, reducing stress and creating a sense of happiness.
The way that we implemented this therapy was we brought them outside to lay in the sun. So we went into the courtyard of the facility. We had them lay down on the grass in, a nice sunny area where they could kind of relax and get comfortable. We played music for them, specifically a song by Marconi Union called Weightless that was specifically designed to reduce stress. This was created by therapists. And then we walked them through pranayama, which is a series of breathing exercises utilizing different breathing styles and durations and having them specifically focus on trying to relax their whole body and focus on their breathing.
For our evaluation, patients reported a reduction in anxiety and increased feelings of relaxation. Majority of the patients stated that they would utilize these techniques when feeling overwhelmed or anxious.
Thank you.